Hello, my dear friends. This is Dr. Charles from PatientCareLinks, where we share practical health lessons drawn from real cases we see every day. Behind many cases of a painful, swollen, or deformed arm after an accident that people dismiss as the bone will join by itself, there is sometimes a much deeper problem quietly unfolding beneath the surface. A problem that can affect the bone, joints, muscles, nerves, and blood vessels. And today, I want us to discuss an important issue that continues to affect many people: why a broken bone should be taken to a doctor, not a herbalist or untrained bone setter. The fall, the road traffic accident, the sports injury, the sudden pain, the swelling, the inability to move the arm, the fear and confusion that follow. At that moment, many people are faced with a decision. Should I go to the hospital? Should I try traditional treatment first? Maybe the hospital will be too expensive. Sometimes, because of fear, cost, or cultural beliefs, a person takes a broken bone to someone who does not have the training or equipment to properly diagnose and treat fractures. For a short time, everything may appear better. The pain may reduce, the swelling may decrease, the person may believe the bone is healing correctly. But underneath, the fracture may not be properly aligned, because a broken bone is not simply a painful area. It is a structural injury that requires correct assessment. A fracture requires several things for proper healing. The broken bone pieces must be positioned correctly. The limb must be kept stable. The blood supply must be protected. Doctors use examinations and x-rays to understand exactly what has happened. Without this, it's impossible to know the displacement or if nerves and vessels are affected. When handled incorrectly, the problem may not be obvious immediately. The arm may not be straight, movement is limited, pain continues, strength does not return. The hand feels weak or numb. Bones are living tissues. When a bone breaks, the body immediately begins a repair process. But if the ends are not properly aligned, the bridge may be rebuilt in the wrong position. From the medical perspective, the goal is not simply for the bone to join. The goal is for the person to regain normal movement and function. Some fractures need a cast, others need surgery. A bone that joins incorrectly may leave someone with permanent stiffness, chronic pain, and a reduced ability to work. This is why professional assessment is critical. The first choice after a fracture can change the future. Do not forcefully straighten the limb. Do not massage a suspected fracture. Support the area and seek a medical facility immediately. Pharmacists warn that pain relief does not mean the bone is fixed. Pain medicines can reduce discomfort, but they cannot realign a broken bone or restore a damaged joint. Dietitians remind us that the body needs nutrients, protein, calcium, and vitamin D to heal. But even the best nutrition cannot correct a bone that has healed in the wrong position. The encouraging reality is this: most broken bones can heal successfully when they receive proper medical care. The right decision after a fracture can protect someone's future. Observe the pattern, protect your bones. After an accident, go to a qualified medical facility. Do not let misinformation turn a treatable injury into a lifelong disability. Patient Care Links is here to share practical health lessons for you and your family. Reach out to us for more information. Let's protect our health together.